Hello friends, welcome back. This is in continuation with the previous post. Let's talk about the Wernickes Korsakoff syndrome. Wernickes Korsakoff syndrome is a serious adverse effect of alcohol use. Actually, Wernickes and Korsakoff, these are two different pathologies, but generally we put them together because they occur around the same timeline. Wernicke's occurs first, and you can reverse it if you recognize it early enough. You recognize on time and you advise the patient to stop drinking alcohol. You replenish the thiamine deficiency. But if the patient, let's say, continues drinking, and then is going to progress to irreversible Korsakoff syndrome, in which there's permanent damage to the brain. So the key is to intervene early to prevent further damage to the mammillary bodies in the brain. Uh, Unfortunately, we don't have many symptoms associated with the Wernicke's, except for the internuclear-ophthalmoplegia, which is the main symptom associated with that, and in which the patient one eye has a gauge preference over the other. The way I remember, I'm sorry to be a little funny here, is patient, let's say, who are drunk, they don't know, where they are, or deep inside their imagination, probably when you might have noticed it to people who are drunk, probably they still want to thinking about drinking more alcohol. The way I remember is like maybe the one eye or the mind's one eye is on the bottle of alcohol sitting on the shelf, and the other eye is on a beautiful subject sitting across the aisle. So that's how I remember, like, the two different targets when you're out with alcohol, you know. So internuclear ophthalmoplegia, guys, that's the symptom you should be looking for. Whereas in Korsakoff, personality changes, memory loss, anterograde amnesia, hallucination, psychiatric disturbances. So the key is to recognize early enough, replete the thiamine, advise the patient to stop drinking. And thank you for watching. Again, same advice: no amount of alcohol is safe for health, so stop drinking.